Anyone who is pregnant when they reach the end of their term is always concerned about giving birth. When it comes time to give birth, everyone asks the question, in my case, should I have a natural delivery or a C-section? So is natural birth better or is a C-section better? In reality, of course, we always prioritize natural birth whenever possible. However, in cases where there are indications for a C-section, then we have no choice but to go through with it. So, in cases where you're having your first baby, if there's no indication for a C-section, like the baby isn't too big or the position is normal, not breech, or there aren't any other complications, then we prioritize natural birth because it's still better. If you have a normal delivery, your recovery time is shorter, you heal faster, and you don't have long-term complications. With a C-section, if the surgical technique isn't done properly, it can often leave sequelae like a scar that doesn't heal well. And what happens with a poorly healed scar? Those dealing with infertility will clearly see the impact of that. For some people, once the scar doesn't heal properly, it becomes very difficult for them to have children later on. In severe cases of poorly healed scars, there can be constant discharge, and during the menstrual cycle, there's persistent bleeding, dark blood that keeps coming out, which is very uncomfortable. So in cases where you've had surgery like that, sometimes the doctor has to perform a laparoscopic surgery to fix the scar again. That's why it's really troublesome. So especially with procedures like abortion or emergency surgeries done too quickly and not properly, they can often leave behind those after effects.